Hey everybody, welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System, and today's episode is titled Community Conversations, Improve Your Heart Health. To help us do that, because you certainly don't want me doing that, that's for sure, is my guest for today's show, Dr. Joshua Weisbrot. He is a cardiologist with Morristown Medical Center, part of Atlantic Health System. Doctor, good to see you.
Good to see you guys too. Thank you so much for having me today.
Awesome. We're going to cover a little bit of ground, folks. But for those of you who may be new to Community Conversations, maybe you haven't seen one of our shows before, the doctor and I are going to chat for a little bit. This really is, though, very much a three-person conversation with you guys playing a role, too. In the chat thread along the side of the window there, if you hear something that you want a little more clarity around, or maybe you have a question, too, got to be on topic, though. Please keep it on topic. Feel free to enter it into the chat, and we will get to as many of those as we possibly can. We've solicited some questions from our audience ahead of time, too, so we got a couple that we can touch on to involve you guys right away, but certainly encourage you to reach out if you have any questions. If for whatever reason you miss any part of our program, don't worry. All of our community conversations live on our website, atlantichealth.org, where you can find a couple of other resources that I have a feeling the doctor and I are going to talk about today. But all of our shows are there. And then, of course, subscribe to our YouTube channel where you're watching this right now. That way you never miss any of our content. So, that all having been said, why don't we get to it?
Sounds good.
Okay. All right. So the title of our show, as I said, Doctor, is Improving Your Heart Health. I've got to believe there's a myriad of ways to do that and a myriad of things we're going to touch on today. But just to kind of start with an overview, are there, and this is actually one of the questions we got from our audience ahead of time, what are some of the simple thoughts you want people to keep in mind when we think about improving heart health?
Yeah, no, absolutely. When we think about heart health and how people can improve their heart health, we look at a concept from the American Heart Association called the Essential 8. And of those 8, they divide them into 2 categories. The first category applies to everybody, whether they have a lot of risk, a little risk, and at all points in life and at any age. Those are the things that we think about as lifestyle things that people can do to improve their heart health. Things on that list include things like eating healthy, making sure you're eating a healthy diet, keeping yourself physically active, and obviously a lot of details depending on where you are, what your activity level is in life, what that means to the individual person. But for everybody, to get their body moving, to get their heart rate up, and to use that to help control really the other portions of cardiac risk that we'll talk about in a minute. Certainly, if anybody's smoking, we want them to stop smoking. We want to encourage the people who aren't smoking not to pick it up as a habit, certainly a very bad habit, and that's one of the 8 things that we have on that list. And then the last, which is the newest one on that list, involves what we get asked about and talk about a lot in terms of a risk factor in the office. Managing stress, controlling stress, and making sure you get good and healthy sleep. And they actually expanded from 7 to 8 and included 8 on the most recent version of these risk statements. So sleep, while we've known for a long time has been a risk factor, has sort of made the marquee now and the landmark of things to watch out for. And I sort of, when I talk about that, include stress and managing stress along with sleep, which we know can be a risk factor for really all sorts of both cardiac and other disease states when people are trying to keep healthy.
I would imagine the pandemic, from a stress-related standpoint, and even activity too, I'm sure has been quite a challenge for some people, for sure.
Yeah, absolutely. I think we're seeing people who have taken the pandemic, and some of them who've gotten great motivation for it, and some people who used it as motivation to get them healthier, and a lot of people, as I think, as you're pointing out, and probably more, who with a lot of stress weren't able to do those things, and now sort of both trying to catch up as they get back in to see their doctors again, as they catch up on the health maintenance topics that during the pandemic maybe weren't on the front and center. It was sort of, we've got to get by, and also using these lifestyle factors to get themselves healthy again, get themselves motivated again. And I think you're right. I think stress management through what was a difficult time for just about everybody is really, really important. So we're hoping that we're coming to a time now where we can use that, understand it, and use it to help get ourselves healthy. And then there's the other side of it, right? So those are the 4, and in that area, people have a lot of control. And my message there is, when I see people in the office, is We want to talk about them. We want to mention them. We want to see where people can improve. But most importantly, for me, it's about motivation, because while a doctor can help motivate you and get you there, so can your friends and your family, and finding a support group outside of the doctor's office. And while it's important for us to mention, we really want to get people hooked in with good support beyond the office walls as well. So we find that really, really important for people to have that support, both from the standpoint of stress management, but also healthy eating and regular activity, because those are really community things, and things that usually involve more than one person, right, amongst families and friends. And then we look to the other side of the coin, and that's where I think about sort of cardiometabolic risk factors. And that's the area where it's right, we want to get control of our heart health, get control of our heart risk by understanding where we are on that spectrum, and understanding what our risk is. And those are really the traditional heart risk factors that we look at, right? When we look at people, right, get your blood pressure checked. If it's not good, let's figure out how we can get it controlled, whether that's with lifestyle, whether that's with medicine. Get your cholesterol looked at, figure out based on your level of risk where your goals should be cholesterol-wise, and we've got a lot of tools to help figure out that risk and to help do that. And then the more metabolic factors, which we certainly as cardiologists lean on our help from the primary care doctors and the endocrinologists for these cardiometabolic risk factors that have a big impact on heart risk, a big impact on heart health, a big impact on overall health. But it's definitely a team game when we're talking about things like managing and monitoring blood sugars and diabetes, and managing and monitoring weight. And weight's one of these that we have some control over by the lifestyle factors, but we're learning more and more as a cardiometabolic risk factor, and metabolism and genetics play such a big role. And there's more and more that we can do to help motivate people to get that better. And even now with our metabolic programs and the endocrinologists, sometimes with medicines to help people who have trouble, even if they're doing everything they can lifestyle-wise.
Something you mentioned there, the genetics portion of it, was a question that I believe some of our folks have had, and one that I'm curious about as well. The role that family history may play, because you may have some folks who are saying, on those lifestyle things, check, 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 I got them all figured out, but I'm still worried. Are things like family history a consideration?
Yeah, no, it's a great question. So yeah, family history is really, really important, and especially when we're thinking about cardiac risk, right? When we think about risk of developing plaque, risk of having a heart attack, risk of having a stroke. The first question I ask when people come in, before I even ask them, right, what's your everyday life like? What do you do for exercise? What do you do for activity? Before I even walk into the room, we ask them, right, how's mom and dad? Had they had heart disease? Is it there? And it's one of the challenges, right? For a doctor, it's frustrating, because it's easy to say, hey, these are the things you have to do. Here are the things that I can motivate you to do. It's not easy, and it's frustrating to some extent. And I share with the patients the frustration when they come in and say, Doc, I'm doing all of those things, and something bad still happened, or my numbers still aren't good, or my pressure's still high. And in addition to knowing the things we've got to watch out for, we've got to know our limitations, and we know lifestyle plays a really, really big part, and lifestyle is always plan A. But beyond lifestyle, we have a lot of tools now to help treat these things. But yeah, family history, while it's not included on that initial essential 8, really is right there next to it. And certainly family history is something that we can quantitate to some degree. It's not just, is there any heart disease in your family? It's who had heart disease? How close were they? Was it first-degree relatives, mom, dad, brothers, sisters, or children? How many of them? What age did it come on? And those things all kind of go beyond the basics of, do you have family history of heart disease, to color our risk panel, and just like all those other risk factors, gets put in as a piece of the puzzle to, all right, where does that put you cardiac risk-wise? And then going beyond that to come up with a treatment plan to say, well, because of that, we need to be even better with our goals around mostly blood pressure, cholesterol, and all these other risk factors.
Folks, as you're listening, I want to remind you, if you have any questions about any of the things we're talking about, please feel free to put them in the chat, and we will certainly try to get to as many as we can. I want to pick up on something that you were just talking about, this idea of building this puzzle, right? And seeing the different angles, because that's something we're trying to do for our audiences as well. We have, for folks who may not be familiar with it, we have something called a heart risk assessment on our website, which you can go and check out. And I guess that we can talk a little bit about that assessment and how it works, but are we able to draw a pretty clear picture? Can we fill the sides of that puzzle in pretty clearly with the methods and the technologies that are available to us these days?
Yeah, we're good at assessing risk. Risk doesn't mean we're perfect, right? Risk has a lot of statistics in it.
Right.
But you're right. Our health system has developed using some of the tools out there, and really an amalgamation of a few tools that are out there in order to try to make it even more personalized, right? Not just, we took data from the American Heart Association, we took data from Framingham, which are some of the big databases that we use when we're talking about cardiac risk, but we kind of looked at the entire landscape out there, and we said, okay, we've got this data from the Framingham data set. We've got this risk calculator from the American College of Cardiology and the American Heart Association. That does a good job of zoning in on atherosclerotic risk, but there's more to heart disease than just atherosclerosis. So we've included some pieces on our risk score assessment, about arrhythmias. Some of them do include family history, some of them don't. So we've included pieces in our risk score, to make it a more robust calculator than even these traditional calculators there, to get us to a level to figure out, who's really at high risk and needs to, get in and see a cardiologist, who's more in the medium risk category, and certainly everybody should be focusing on lifestyle, should be talking about these things with their primary care doctor and on a selective basis, depending on, as we add the other color to it, maybe are a little bit higher than we thought, should be overseeing, someone like me over at a cardiac office. And then who's low risk? And low risk doesn't mean no risk, but really should be, focusing on general health and focusing on those first four, the lifestyle factors, and maybe don't need as deep of a dive into the beyond the basics. And then sort of to get back to the question you asked, once we do that, we take somebody in, we find what their life is like, we find out on what risk factors do you have there, and try to put it all as a piece of the puzzle. We use some of these risk scores that we have out there, like the one that we share through our website, and we decide, who do we need more information on? Because sometimes, we take this detailed look at someone and we go, all right, you're medium risk and your numbers are here, and based on that, we need to learn more to figure out what our treatment plan should be. And that's when we use additional testing, tests like cardiac calcium scores, to take a personal look at how much plaque you've built up. Sometimes other tests to be sure, wait, you're really high risk. Before we get into what's your risk, we've got to make sure that there's not something wrong now. So let's really get a look at your heart. Let's do a stress test. Let's do a heart CT. Let's do an echocardiogram. Let's see where your heart is now before we delve into the focus now. What's my heart risk? Well, let's make sure there's not something wrong.
Something happening at the
moment. And people who are high risk, oftentimes that's the first step is, all right, let's peel it back. Are you okay now? We check that. Now we can really get into, all right, we know you're at some risk. How do we manage all those risk factors? But we want to make sure that you're okay before we start. And sometimes that's really the focus of our first visit. But all those things fit together and are important.
8,000 people have filled out the heart risk assessment on our website. So if you're one of them, thank you. Hope you were able to get some useful information for yourself there. If not, go check it out, atlantichealth.org, and you can find it on our website there. It's resulted in hundreds of appointments. So, for those folks who are seeking needed care as a result of learning a little more about themselves, that's certainly a good thing. You mentioned calcium scores. Thomas reached out to us ahead of time with a question about how useful those are, how valuable those are. So, Thomas, I hope you're listening. Sounds like that can be a pretty useful tool.
Yeah, calcium scores are a great tool, and we're using them more and more as part of our risk calculation. We now have risk calculators that include calcium score in there, where we can look and see with a calcium score, how much hard plaque do you have? Where does that amount of hard plaque fit you in percentile-wise compared to people in your demographic, right? Compared to people your age, and right, using that to really brighten our ability to tell people about their cardiac risk, set goals around cholesterol, set goals around blood pressure, right? And we try to use it as motivation, right? And I think that's one of the challenges, because we were talking about stress before, and calcium score testing and all this hard testing isn't about making people more anxious and feeling bad about their health, especially when we're on the cardiac risk end of things. It's to take control of it, right? It's to know it's there, to motivate you to be more healthy, and to make sure we do all that we can to lower your risk, but not to cripple people with the information and the worry. We found a lot of plaque. And unfortunately, sometimes we do see that, but we try to motivate our patients and to say, right, no, okay, we found that you have plaque there, right? It's not what we were hoping for. We don't like it either, but there's a lot that we can do about this, right? And there's a lot of things that we can do with lifestyle, with medicines,
medication too,
right? With getting your risk under control to lower your risk and to take it as, right, what 20 years ago, before we had tests like that available, may have been subclinical disease that we weren't picking up and we didn't know about. And some of those people we were meeting in emergency rooms clutching their chest, and now we can lower the chance of that happening by controlling people's risk factors and doing it even more proactively than we do at a general population level.
Technology continues to drive everything in our field forward. We're on this show, you'll frequently hear about a lot of the new innovative techniques and new doorways that technology have opened. On this assessment portion of it, everybody seems to have a different device that they wear now when they exercise, or even just during the day. How useful are those in measuring risk in any way?
Yeah, no, it's great. And it's a great question, and it's something that we talk about every day. I think we're still learning. They're new, and they're technology. There are some spaces where the use is well studied and well classified, right? So one of the things I talked about was blood pressure. Home resting blood pressure monitoring. If any of my patients are listening, they know I talk about this all day. Right, it's the scoreboard blood pressure number in my office. We'll check your blood pressure when you come in, but right, what I try to teach my patients is when I ask you how's your blood pressure, you're gonna tell me my blood pressure at home when I'm resting is usually on the top number in 10-point ranges, on the bottom number in 5 or 10-point ranges, and that's your blood pressure number on the scoreboard, not the one that we got in the office today, not the one that somebody got right after you had an orthopedic surgery and you were still recovering and in pain, and they're so valuable. So is it everybody should have them? Maybe not everybody, but anybody who has borderline blood pressure or high blood pressure, they just provided so much more 360-degree insight. So for blood pressure management, they're great. We've got a lot of tools with wearable technologies and home tools in the arrhythmia space, right? A little bit different than the heart risk. When we talk about heart risk, we're usually talking in the atherosclerotic blockage, heart attack, stroke space, but there's a lot of overlap with the risk of arrhythmias with that too. And we've got, for people who have palpitations or have had arrhythmias before, rhythm monitoring devices that you can either wear on your wrist at all times, like the Apple Watch, or devices like the Cardia device and several others, where you kind of put your fingers down on it and it can really help give us a more complete picture, sometimes along with medical grade home patch monitors, which is also relatively new technology, which has transformed the way that we've been able to diagnose and monitor arrhythmias. But there's a lot out there. We're still learning the right strategies, and we're still learning how the data we gather from those can be used to affect medicine choices and things like that. But there's a lot of research ongoing in that space, and we're already integrating that information that people bring to us from their home monitoring with those sort of devices. And then a lot of the home monitoring devices or wearable technology that we have out there, like the first 4, the lifestyle end of the cardiac risk, they're motivational, right? I don't know how many of my patients come in and say, right, I've got this fitness tracker that I wear on my wrist. It said I was only doing 5,000 steps a day. I heard that 10,000 is better, and now when I go to the bathroom, I go to the further bathroom, and I'm up to 7,000. And now that the weather's better, maybe I'll make 10. And we hear that every day for people. So I don't know this improves your health, but I think for a lot of people, they can provide motivation to improve their health.
We hear from a lot of folks, I hear from a lot of physicians who come on the show and talk a lot about how, we really have to avoid this syndrome of folks saying, I just don't want to know. I don't want to know. I was living my whole life peacefully, not knowing, and I don't want the stress of having to know whether or not I've got these issues. But and we always encourage folks to push past that, because we can make a difference for people. It sounds like once you have a sense of what your risk factors are, we have tools and tricks to help mitigate that risk. Sounds like time can be really your friend here if you're aggressive about pursuing this knowledge soon.
When you know early, time is on your side.
Right.
Just like everybody talks about in smoking, and it's a pretty established concept of FACC years. The same applies for high blood pressure. The same applies for high cholesterol. The risk of cholesterol and blood pressure isn't about minutes or days. It's not what's my blood pressure now, what's my cholesterol now. It's what's it been over 5 and 10 and 20 years. And there's growing consensus in the cardiology community that the goal for managing risk is going to be detecting this stuff early and in the right people intervening early. But I understand where patients are coming from when they say there's stress and anxiety with knowing.
Right.
There's stress and anxiety of the medicalization of the I have this diagnosis of, whatever it is there. And I think to some degree, we also have to be wary as the pendulum shifts to earlier diagnosis, earlier testing in selected individuals, is making sure we're selecting the right individuals. And all of these tests, and especially when it gets beyond just tests and risk assessments for treatment, I'll tell you, I know the cardiologists that I work with and the cardiologists I know, we're careful, and we're thoughtful. And it's not you come in and we give you a medicine to take. It's a risk assessment, and I've done risk assessments, some of them based on the heart risk assessment that we have on this, based on referrals from our primary care physician, and someone comes in and I say, here's your level of risk. I want you out there exercising. I want you eating healthy. You don't need any medicines right now. So just because you come into the office doesn't mean you're going to leave with a prescription, you're going to leave with more medicine. Everyone's going to leave with motivation to live a healthier life. That's our goal. A lot of these people are going to motivate me because they're doing such a good job. And sometimes I see someone go, wow, that's interesting, and to tell the next person, not that person was, but I heard someone tell me this. Isn't this such a great idea?
Yeah, sure.
I'm going to try it. Maybe you should. So to some degree, especially on the lifestyle end, we learn how to motivate people from the people that we see. But I think the message is important because of that medicalization is knowing your risk doesn't mean going on medicine. Knowing your risk means taking control, getting motivated, focusing on lifestyle, and in the right people, using medicines to lower that risk. But that's our job, is to help you figure out if you're the right person, or maybe, hopefully, it's great to see you. It's nice to meet you. Get out there and get moving. Right,
sure. A couple of folks have commented, and we had a couple questions before on atrial fib, AFib,
yeah,
as it's known. We have done some programming specific to AFib, which is, some of the questions dive a little deeper into specific causes, specific remedies, things along those lines. I would encourage folks to check out some of the content we have around atrial fibrillation on our website, atlantichealth.org, if you want to dive more deeply into that particular cardiovascular issue. And we have a lot of physicians who have come on this program and others to talk about AFib. If there's anything at all you want to add about it, but I think I would encourage folks to check that out.
Yeah, too. I'll take it as a chance to at least briefly sway that direction, right? So, sure. Right, when we think about heart disease, we think about atherosclerosis, heart attack risk, stroke risk as one of the big categories. There are a few other big categories too, and a lot of the risk factors, and especially a lot of the lifestyle advice, applies there too, because the risk factors for atherosclerosis are very similar, not exactly the same, but for arrhythmias like atrial fibrillation, for congestive heart failure and issues with pumping function or how the heart relaxes, another one of the big buckets. And then another bucket for some is valve disease, and there's some overlap there and monitoring there. But when we dive a little bit into the arrhythmia space, as you do as you talk about AFib to some degree, the lifestyle advice there is the same. There are a few other things that we've got to look for. Alcohol is one that we think about there. But part of the reason why we included on the heart risk assessment that we have on the website questions about atrial fibrillation is because, we see it every day. It's very common, and we know that when I think about heart risk assessment and when we bring someone into, to see them at a cardiac office, we're thinking about those things too. But a lot of the advice, at least on the lifestyle end, is good. I've seen some of the conversations that you've had with our excellent electrical team, and that we work with really closely. People like myself, a general cardiologist, really closely. So for a deeper dive, I'll point you to that content too. It's really good, and but it's things that we see a lot. But I think the lifestyle advice probably applies in that space too.
Good to know. Folks, we are just about out of time, so I want to take a moment and thank Dr. Weisbrot for coming in and joining us and sharing this really important information. Folks, we always try to provide news you can use. This definitely fits the bill there, and we hope, if you want to learn a little more, if you don't have a cardiologist and are looking to find one, to build that doctor-patient relationship that the doctor was talking about, that's so key to getting your arms around this issue, check out the Find a Doc link on our website, and you can sort by geography and by name, all that stuff, all available to you there. Doctor, thanks so much for doing this today. I hope you enjoyed it, and I really appreciate you sharing some time.
Oh, thanks for having me. It was a great conversation. Thank you so much.
Great, folks. All right, well, thanks for tuning in. If you missed any part of it, remember, subscribe to our YouTube channel. You'll see everything there. I'm Luke Margolis, your host for this show, and we will see you next time.
Thank you.
Nicely done. That was great.